It is my pleasure to welcome you to today's webinar. I'm Caitlin Brewer. I'm the President and CEO of Darkness to Light, and I'll be moderating today's conversation. Before we get started, I'd like to address a few housekeeping items. If you are joining us today through Zoom, please say hello and share your thoughts with our conversation in the chat box function. To submit questions for the panel, use the Q&A function. We will try to get to as many questions as possible at the end of our conversation. But just so you know, there are potentially 1,500 people on this webinar today, so we might not get to 1,500 questions with 10 minutes at the end of the session. If you're joining us through the YouTube stream, you can chat and ask questions in the chat box there. We are recording this webinar and we will make it available after the session. We will also be providing contact info and resource links from all of our amazing panelists today. So make sure you watch for that email when we're done. Lovely. So let's get started. First of all, I just want to thank each and every one of our panelists for jumping on with me today. I know it's probably the first time everyone's put on a real blouse and makeup in weeks. And I know it is for me, and so I think it's well worth the cause that we're talking about. For those of us in this industry, since day one of quarantine, I know I have felt some kind of way about children and protecting them, and I know each one of you feel the same way. So we wanted to make sure that we brought together our partners to help all of us in our community keep kids safe. And so I will start by introducing each one of you in a short, brief bio. First up is Susan Kennedy. Susan, give a little wave. Susan is the Prevention Program Manager for the National Center for Missing and Exploited Children. She's also a Darkness to Light authorized facilitator. Susan drives the implementation of the prevention program in line with best practices of child development and protection. Prior to working at NCMEC, Susan worked at the Center for Alexandria's Children as the program director and conducted several hundred child forensic interviews and oversaw the development of a community-based prevention program. Patty Daly-Lewis is the executive director of the Beau Foundation for the Protection of Children. She's also an authorized facilitator. For those of you signing in from Delaware, I'm sure you've probably seen her. And she is a member of our board of directors. As a practicing attorney for 34 years, she was previously the Deputy Attorney General with the Delaware Department of Justice. She served as the director of the Family Division for 10 years, where she supervised units handling child support, child abuse, and child protection on a statewide basis. She also served as Attorney General Biden's policy advisor on children, families, drafting and testifying several bills which became laws and are all protecting vulnerable victims of violence. We then have Stacy Pendarvis, who is the Vice President of Programs for the Monique Burr Foundation for Children and is a Darkness to Light certified instructor. Stacy oversees all program efforts related to the Monique Burr Foundation's Child Safety Matters programs and all related prevention activities. Stacy has 20 years of experience in the child welfare and prevention field and has educated thousands of adults and children on various protection issues. Tiffany Sawyer is the Director of Prevention Services for the Georgia Center for Child Advocacy and is also a Darkness to Light certified instructor. Tiffany oversees the Georgia Center's statewide sexual abuse prevention initiative, which has trained over 140,000 adults. She's also served as the past president of the National Coalition to Prevent Child Sexual Abuse and Exploitation. And last but certainly not least, is Janice Whitlock, who is a senior advisor for the JED Foundation, an organization that works to protect the emotional health of teens and young adults. Janice is a development psychologist and a public health specialist with over 3 decades of experience in social, emotional, and mental health promotion. She is the founder and director of the Cornell Research Program in Self-Injury and Recovery and currently serves as the Associate Director for Teaching and Training in the Bronfenbrenner Center for Translational Research at Cornell University. So thank you again, my distinguished panelists, for joining. So I would like to start by moving into some basic conversation about meeting the basic needs of children during this time. So we went from, long-term strategy and prevention to crisis mode. And so, Stacy, I'm going to pose the first question to you, and just how have you at the Monique Burr Foundation sort of thought about how COVID-19 has changed the way we think about a child's basic needs?
I don't know, Caitlin, if it's necessarily changed the way we think about it. I'm a social worker, so I always start with the basics. And if a child's basic needs aren't met, then you can't meet their higher level needs. So we just kind of went back to the basics, and we're trying to make sure that everybody is on board with that message. You know, schools had to shift gears so quickly. I was having a conversation with a district level, well, actually it was a school board member, and she said it was like turning a aircraft carrier on a dime is what they basically had to endure to make that shift. And in 1 or 2 weeks of kids being on spring break, bring them all back virtually. And so I know, you know, schools have done a really good job of thinking through things like our kids getting food, and a lot of districts are providing nutritional services and laptops and Wi-Fi. But I really wonder if they've thought through the safety needs of kids, you know. So if you think about Maslow's hierarchy, you've got basic physiological needs, and then you've got safety needs before you can move on to all the other needs. And learning's at the top. So learning's the last thing that we can prepare kids to do. So what we're doing is we're really just trying to continue the message that, you know, safety is essential. And, you know, right now we're all child advocates, so we're all very keenly aware of the increased risk that kids are, you know, in isolation potentially with abusers, and the fact that educators are some of our top reporters in this country, and educators aren't in touch with those kids as much right now. And we're trying to give adults really concrete, actionable things that they can do to stay in touch with kids. So, you know, make sure their basic needs are met, do distance check-ins. You know, when we were on the call the other day, you mentioned a safe word. We've talked about safe words, using apps like Mood Meter, which is a quick way for an adult to check in with kids. So we're really just trying to provide resources that give concrete things that people can do.
Tiffany, I would love for you to expand on that a little bit. What are some of the actionable things that adults can do, you know, now that they're distancing? I think Stacy's point about teachers being 52% of the reports is an incredibly important conversation. So what are you finding at the Georgia Center that you're talking about with your constituents?
Yeah, so one of the things that we're doing is trying to identify those adults who are still having contact with children, whether it be teachers virtually, whether it be other school professionals face-to-face. A lot of our schools, as Stacy mentioned, are providing those nutritional resources for families. And so our nutrition staff, and in some cases our bus drivers, are delivering that food and other services to families. And so getting to those individuals and helping them understand, you know, what are some questions that you can be asking children, not only to address their physical safety, but also their emotional safety as well. So looking at engaging them in conversation with open-ended questions, asking about their feelings, you know, how are things going at home? Who are you interacting with at home? Engaging them a little bit more to understand what does their home life look like and what kinds of services and supports they can provide, because sometimes it's just that parents need resources to be able to provide those basic needs for them, and they just don't know who to reach out to. So I think thinking through creatively who is still interacting with youth. Pediatricians, I know, in a lot of cases are still interacting with youth for well visits and for sick visits. So reaching out to them and making sure that they're adding a few questions to some of the things that they regularly do. I know that even some kids are still doing recreational types of things, like my kids are still doing like guitar lessons and dance lessons virtually. And I've been really pleased to hear that they are asking questions about their safety. So that was good to hear. I think as much as we can get out to those individuals to provide some of those check-ins, not only for their protection, but we know that these connections, these social connections outside of their parents and caregivers, are really, really critical for kids' emotional and mental health. So that's really, really important. And doing regular check-ins. One of the other things that we've seen that schools are doing is to track the check-ins that they're having with kids, so that they can identify who are the kids that we're really concerned about, that we haven't heard from parents, they're not turning in homework, they haven't had any kind of touch point in the entire week. So that goes on a little checklist that they might need to do an added check-in with those children.
That's a great point, Tiffany. I just want to highlight that you are identifying the most vulnerable kids that you probably knew something was happening. Maybe you've made a report before. You know, I think that is a great way to sort of prioritize, you know, who you check in on and how, you know, to manage your day. So that I love that.
Yeah, and if I could quickly just add to that too, you know, what Tiffany's saying about identifying the people that are having contact, I think is critical. But I also think we all need to be making sure that the people we know are checking in on kids in their lives too. So, you know, have your child have a Zoom call or a FaceTime call with their friends, but that gives you the opportunity to check in with those kids as well. Reaching out to family members, neighbors, in ways that maybe we didn't do before when we saw them every day or we interacted in person every day. But now we have to step it up and do it virtually, but that's going to take a little bit of effort. So I think the more we as child advocates encourage all the adults in a kid's life to be checking in on them, I think that expands the circle that's really kind of watching out for them.
Yeah, and Stacy, just to add to that, I think it's important for us to remember though that we cannot guarantee any kind of privacy or confidentiality with these conversations. We don't know who's standing on the other side of a laptop or a phone with children there, so they may not be in the view of the video, but so also asking questions, but then providing resources is really helpful for a child. Like, you know, you always have so-and-so to talk to if you need anything, or a school counselor is here to reach out. So identifying resources and providing them with resources at the same time that you're asking questions.
Yeah, that's great.
I mean, Tiffany, that's a great point, and I think it applies to the pressure that the children are probably feeling. And so, Janice, I want to bring you in here and say, you know, what role does mental health play in how we think about the basic needs of children at this moment in crisis?
I think it plays a huge role in this particular moment because everybody's mental health calibration is going to be challenged. I mean, even people who are pretty regularly calibrated are probably feeling it. And people who are vulnerable, whether they're adults or children, are really feeling it. So if parents struggle already with a mental health challenge or an addiction or something, it's very likely that it's going to get activated during this time point, and they're going to need extra support. Going to probably have to go out of their way to find it on their own. And all children, regardless of their status, are going to need extra support because this is probably incredibly confusing for them. And the extent to which children look to adults for signals about how worried should they be, that's something that I think parents need to be very conscious about.
So are there any tips that you might give to the safe adult in a household that could help them process through that with their child?
Yeah, there's a few things there were three things that I kind of thought about when I was thinking about today. I mean, establishing routines, I know everybody's probably talked about that, it shows up, but it's really important. It's especially important for kids because they, as I just said, adults tend to sort of telegraph implicitly and explicitly how worried to be. So routines that balance connecting, learning, expressing or discharging energy, which I'll talk about in a second, with regular meal times and some simple downtimes are going to be comforting for everybody, especially kids, but also adults. So routines are really critical. And having the weekdays be a little different than the weekends, all of that should be sort of thought about. And then identifying and actively using supports. I mean, I mentioned that, especially adults who who are used to being able to get therapy, or they're used to going to AA meetings or NA meetings or that kind of stuff, they either need to be assisted or they need to be sure that they take the incentive to go find those things online so that they're supported, because how balanced they are is really going to have an impact on the children. And then lastly, the thing that I think I don't see as much out there already is finding outlets for feelings that are coming up. Everybody's got feelings coming up, and children are exquisitely sensitive sort of to the collective. So I would imagine that they're going to have more acting out behaviors, potentially more acting in behaviors, certainly more anxiety related behaviors. And everybody needs to know, A, that that's likely to happen, and that it's really important not to push it down, push it away, but to find an outlet for it. So if adults can find unique outlets like, I don't know, painting, music, writing, journaling, anything that allows them to like get it up and out, not shove it away or make it go away, and then helping them help children do that is going to be really helpful.
Wonderful.
We all need to find a way to discharge.
Yeah, absolutely. I find if I don't get on my bike and ride for at least an hour and a half every day these days, I mean, it's crazy. So I hear that discharge of energy.
Caitlin, to follow up with what Janice said, so I have a high school senior that is supposed to be graduating and is dealing with a lot of emotion right now around that situation. But somebody said something interesting, and I think it would be a fabulous tip for any child was, journal right now what you're experiencing, what you're seeing, what's happening, what you're feeling, because A, it's therapeutic, but B, you're going to be living history. And someday when your kids and grandkids are reading about this in their history, well, they won't have history books, but online, you can pull out your journal and they can read your handwritten notes about what you experienced through this. So, it's a win-win for kids to do something like that.
Actually, I'll just put in a little plug. I wasn't going to say anything because I didn't think about it, but we started because for exactly that reason, Stacy, when this started about 3 weeks ago, I launched a little study. It's called Storytelling in the Age of COVID-19, just for that. So people could journal into a space that would be collective. And I'm happy to provide the link if you guys want it. But
absolutely. That's fabulous.
And then I'm going to create a little book for everybody who participated. It'll just be a cross section of sort of entries. It won't be anything fancy, but just so everybody kind of can feel like they're part of this amazing moment in time that is both incredibly stressful but incredibly unusual and certainly historic.
I want to focus and bring Patty and Susan to the conversation a little bit on the online aspect of what's happening. So I think we talked very much about how schools have transitioned almost immediately, and I'm impressed. I know my team has done a really wonderful job transitioning to online remote work. So there's lots of benefits to becoming a connected culture this way. There's also a lot of things that make us all nervous. More kids online means more predator engagement. And so Patty, I'll throw it to you first. With kids spending more time online, what are some of the precautions that we need to be advising parents on and, youth serving organizations about?
So we've actually done a couple of trainings recently on that. I think we've probably trained about 300 youth serving organizations and educators to really understand that we are now where they are. This is their space. They've been Zoom gathering and Facebook gathering and all the other things they've been doing. And now we've turned that space into school for them. And so we have to talk with kids about the difference between their schools and their hangouts. We also have to talk to them and to the people that have them online about remembering that it's important to give them safety tools. A lot of kids that haven't been online so much are now. And so parents may not have talked to them about what to experience. So when they get, for example, reach outs from predators, they're not really sure what they're supposed to do. Now is the time. We have a couple of ebooks on BeauBidenFoundation.org. I know our friends at NCMEC have done amazing work on use this time to talk with your kids about what's out there, number one. And number two, use this time to educate yourself. The fact of the matter is the average person on the gaming devices is 34 years old. And so when you're putting your children in the living room and say, go game for 2 hours, you're putting them with people you don't know that are reaching out to them, that are that there's a strong likelihood are not safe. So parents need to really up their game in terms of what their kids are doing and paying attention to their extracurricular communications. Susan, I know you guys have done amazing work in this area as well.
Yeah, I really like what you said too about realizing that we are in their world now. So this is a world for a lot of our kids they have been engaging with, and a lot of times they've been doing it without a lot of parental guidance and adult oversight as well. So you know, figuring out as we are together apart and together online, how do we merge kind of adult and kids, and how do we be online together and talk together? Because what you said is certainly true. Kids need to be equipped with awareness of what's out there, what could happen, what they do with, you know, if something happens. I think too, what we as adults need to keep in mind is that we're not only going to be thinking about dangers or threats that are posed by strangers online, which certainly happens. Certainly we should know about privacy settings. We should talk to kids about privacy settings, but we also need to realize that kids are engaging with people they know who don't always make good choices. And a lot of what we see with sextortion and online enticement and sexting pictures that go out, the players involved are actually people you know. They're peers in class, they are former boyfriends, they are former partners. And so when we talked about with kids about online safety, what we really need to be thinking about is merging the ways we're talking about kids about real world safety with online safety. So if someone's pressuring you to do something that you don't want to do, whether it's a physical, you know, physical thing that your boyfriend wants to do, or it's something that a picture that they want to send, right? The skills, the conversations are more similar than I think we're used to thinking about. And so talking with kids about, you know, what are you going to do online today? Who are you going to see? Show me the apps we're going to use for school and how they work. Show me the apps that you're going to use during your free time and how they work, and what's going on with you today, and what happened with you today. What did you learn? What did you do? Who did you talk to? Was there anything that happened today that, you know, wasn't that great? Or anything that made you uncomfortable, or anything that you witnessed. And so making sure that we're having those conversations just as we would think about, and I know it's, you know, as Caitlin said, I'm a facilitator of Stewards of Children, have been for a very long time. So those kinds of conversations about, you know, when you go to a play date, we're going to talk about what happens if this happens at the play date. And when you return, we're going to check in about it. Same thing with online life is really, really important.
And it's possible in the online world to make sure that it is, you know, one of my most favorite part of, and like Susan, I've been a facilitator for 11 years. Mm-hmm. Make sure that every interaction is interruptible. Mm-hmm. Make sure that every interaction is observable. You can do that online. Mm-hmm. Sometimes for teachers, they like to put up a little bit of a fuss, like, we can't do that. That's impossible to do. In fact, it is possible to do. And reaching out to the schools where your kids go and say, like, what are your policies and procedures around activities that are interruptible, activities that are observable? Should my children be one-on-one in a Zoom room with anyone if I can't walk through and see what's going on? So it really does heighten the level of engagement that parents must have with their kids. They also need to talk to the schools about the privacy concerns of children. You know, what is the law? Like, Zoom was not built for children. Zoom was built for adults. And so when we look at some of the statutes, both federal and state, around children's privacy, you know, this is serious. We know everybody's trying to engage everybody else, but teachers don't belong taking a picture of their class on Zoom and putting it on their personal page. That's not right. They should never do a thing like that. So parents need to be engaged with schools in terms of, what is your code of conduct for this online learning environment? What are you doing differently? What can we do to help? How can we make sure that no interaction is not observable and not interruptible? Because that is where trouble starts.
Yeah. Yeah, and for kids too, I mean, there's going to be a tension for parents, you know, and I know I'll face this tomorrow because my first grader and my preschooler have Zoom meetings at the same time, right? So how do you have them in a part of the house where they can do their work, you know, especially for older kids who are really at this point absorbing new information in a lot of places. This isn't review, this is new information they need to learn. And how do you make it, as you said, observable and interruptible? So maybe I am going to allow my older kid to be in his bedroom because that's the only quiet place with siblings playing downstairs, but I'm going to come in and I'm going to be in the background and I'm going to interrupt that, right? And so thinking about, how can you set up your space and be very intentional about that so that kids have the privacy they may need, the focus space they may need to do their work, but those are observable and interruptible by safe adults at home. And also thinking about, one thing we see at NCMEC often on our cyber tip line, unfortunately, is that young kids are often left unattended with tablets and devices, and parents are not thinking about the capabilities even young kids have for posting live streams and things like that. So again, that code of conduct piece I love your point about parents to schools and asking, have they thought that through? Because I think a lot of them with this quick turn have not. But then also thinking within a family, where when you have your free open time with your tablet, where in the house can you be? And can the doors be closed? And who's interrupting and what's expected there? I think, kind of from all those different vectors, thinking about expectations and interruptibility and observability is really important. That's a good point.
I'll just pop in here real quickly and say that most routers have parental controls on them now, and a lot of parents I know don't know that, and they don't know how to use them, but they're pretty sophisticated, and I think it depends on the router, but you can often dictate which specific device has, is online, is activated online at any given time, and what it may have access to. I mean, the filters aren't perfect, but they're something. It's better than nothing. And then also the other thing that I have found really helpful as a parent is to know that my wireless provider also has parental controls. And, in order to not have to have showdowns at home, I just called them at one point. I'm like, okay, so all devices need to just go off, or these devices, these ones just need to go off at 10 o'clock. And the kids were really unhappy. My teenagers were kind of unhappy for a little while, but they got used to it. They just know like it. That way I didn't have to worry at 1 o'clock in the morning what my teenagers were doing online.
Right.
So just know that there's tools.
One of our major suggestions to parents is, before you give your children these devices, that's the time to talk with them about expectations and rules. And one of the things we recommend and we have on our website is a contract for parents to sit down, whether their kids are 5 or whether their kids are 15, and say, we're giving you this is what it's for. This is what we expect out of you. And if you violate the rules, this is what's going to happen. And making sure that kids understand expectations, because for a lot of children, parents don't, like, you walk into places before all this and saw kids scrolling at 8 o'clock at night on their iPad, a 7-year-old in a restaurant, and the parents have no clue on what they're doing. Now it's even more significant. And look, these children are looking to their parents to keep them safe, to keep them grounded. They really have to step up and say, we understand there's risks. We need you to learn. We want you to have fun, but we need you to be safe.
Tiffany, I think you've been trying to say something for a couple minutes. I'll let you jump in.
I was just going to reiterate what Patty was saying about organizational policies and procedures and a code of conduct, because I think this is a great time for all youth serving organizations, not just schools, to take a look at their policies. It's really similar to the new Protecting Children During COVID-19 or a Crisis training that you all put out, Caitlin, at Darkness to Light, to think about how parents were previously protecting their children and how it's shifting now. The same thing needs to be done with organizations, to think through what were our policies before, how does it shift now that a lot of our work is going virtual, and perhaps it gives them an opportunity to think long term. Maybe they've come up with some really great policies that they can continue after we all come back into the real world. And things like requiring another adult to be on messages that they're sending out to youth, making sure that they're recording all of their virtual conversations or Google Hangouts with youth, even posting helpline numbers for children on some of their Google Hangouts or other platforms that they're using. Those are all really good practices to have for organizations as we look at this changing world.
So this is what we've been doing with our virtual learning environment and virtual communication with kids environment workshops, is we've been going over policies and procedures and making sure that this code of conduct can be adapted and amended where necessary to contemplate this new world. And amazing response we get, particularly from mentors, when we tell them, like, it's really important to make sure that you follow the basic rules to keep kids safe. They are going to be reaching out to you, having a second person, having text messages go to us, even if it's one of the organizations we work with is 826 National. Have a second box that goes to, a general mailbox. Make sure that all of this is observable and interruptible. I can't keep saying that enough. Well, I could, but I'm going to.
Well, I think, Caitlin, it's interesting, what I'm hearing is really that, if I think back to all the years that I've done Stewards of Children, where the most interaction and learning takes place is in the questions, when the participants themselves are communicating about their particular organization or their particular situation. And I think that's the same thing that we're looking at. We're just looking at it virtually. So how can we think creatively? How can we think outside the box right now to make sure we're doing the right things that we need to do? But it brings me back to, and Patty's talked about it, and Tiffany's talked about it, and Susan's talked about it, we've all talked about it, is education. Educating both adults and kids right now is critical. And so we have to do it a little differently. I know we've allowed, right early on, we got requests from facilitators. Can we present MBF Child Safety Matters remotely or Teen Safety Matters remotely? And so we came up with tips and guidelines. Stewards has the online version that you can use and facilitate those conversations, doing it that way. So I think it's critical that we all still push that education component, along with all these other things that we're doing.
Yeah, and Stacey,
are there any special considerations? Oops, hold on just one second. Are there any special considerations about kids under 5 that we need to be thinking about?
As far as educating?
As far as checking in, as far as educating? Yeah.
Children under the age of 5 are at the highest risk for abuse. And these are the times when I am proud that a lot of states, 17 or 18 at this point, are broad mandatory reporter states. One of the things we've been doing is working with organizations, including preschools and daycares, on what it means to be a reporter virtually of an observation of a child. We got a call last week from a teacher who had a very young child, 7 years old, alone in the house with 2 younger siblings. And she's like, I don't know if it's a mandatory report. I don't know if he was just kidding with me. I don't want, DFS involved and hurting the family. The fact of the matter is that these reports to hotlines have dropped by more than 50%. The children that need to be protected are not having eyes on them. So let's, as Tiffany said early, let's make sure that everybody is educated on what to look for. And there are signs virtually with young children as well. And the people that see young children, like grandparents, like neighbors, like the UPS driver, they're the folks we have to make sure understand the importance of safety for young children. This is what keeps me up at night, Caitlin, honestly, is the kids who cannot defend themselves, who cannot talk, and not that they don't have anyone to talk to, they cannot talk. And they rely upon other eyes on them. Every single adult has a responsibility to protect children, period. Whether those children are in front of you or whether you're interacting with them virtually, you have that responsibility. And if the call has to be made, the call has to be made. The Division of Family Services around this country are working very hard to get help for the people who need help. I think it was Stacy who mentioned early on, or maybe Janice, about folks who have alcohol and drug problems that aren't able to go and get tested or aren't able to go and meet with people that help keep them clean. If they are families that are already in the system, then Division of Family Services are going out and checking on them, and not to target people, but to say, hey, you had this problem before, We're just checking in to make sure. That's why people should not ever be afraid to call in a reasonable suspicion. That is the law. Reasonable suspicion. It is not, I saw, finger bruising on their face. It is a reasonable suspicion. And the folks at Division of Family Services have been really working their butts off to make those contacts. But if you know something that they don't know and you don't tell them, we're going to find out after this is over.
Which is a perfect segue into some of the other conversations I want to have. Susan, when we were prepping for this, one of your concerns was that we were going to see a larger percentage of runaways because they don't feel like there is another safe adult. There's no one looking out for them. There's no one reporting. Mm-hmm. Can you talk a little bit about what you're seeing at NCMEC?
Yeah. So we're looking right now to pull together, data and spreadsheets to kind of have something more concrete to say. As Patty says, I think a lot of this we're not going to understand until later, but I can say that already people at our call center and in our missing children's division are seeing an uptick in, we call all children who run away endangered runaways, just as a recognition that all kids who leave the care of an adult are endangered. But we're seeing an increase in those kids running away. And in the narratives and in the reports, what we're seeing, I mean, there's, and you can appreciate if we were adults with, as adults, some of us want to run out of quarantine, right? So some of it is just like this, this is hard. And for, especially for kids and adolescents who have a higher need for, that the social connections and all the things that go on. And so some of it is that, but some of it, as you say, Caitlin, is also, we know some of these kids are not in safe homes. And until recently, they could escape to school every day, or they could go to a friend's house after school. And those options aren't there right now. And so for those kids, running away from home, is their option to try and get to safety. And we're also seeing what we're particularly worried about as well as kids running from foster care placements and from kids who are in some way in the care of social services, because we know those kids are at much heightened risk for further victimization while they're away from home. And you can appreciate, kids in a foster care placement where, maybe that court date that was scheduled for next week, where maybe they were going to go back to mom, is not happening. And I totally agree with what Patty was saying, that these systems are working really hard to respond to these kids, but the reality is there are disruptions, but visits are not happening, and, visits with siblings are not happening, and court dates are pushed back. And so that creates a very stressful environment for kids living in foster care placements. And that's doubly worrisome because we know those kids bring with them a lot of vulnerabilities and some lack of resources that other kids have. And so we are seeing a noticeable uptick, and we're starting to really track data on that to have something more quantitative to say, but our professionals are already really concerned about that phenomena in this environment.
Susan, do you think the states need to focus on opening some shelter care for these children that isn't, it's not a crime? Runaway is a status offense. Providing safe care for them instead of relying on them to just work it out on the streets. That's what worries me. I don't believe in locking kids up or holding them, but giving them an option to say, here is a place where you can go. And because we have so many schools and whatnot closed, we have licensed background check people that can help with this. Yeah. But this is what worries me. And I think I'd love to know what you guys think about opening up some kind of center for these folks, for these kids, have a clean bed to lay their head on and a place to get some food.
Yeah, that's really interesting. I think it would be fascinating to follow up. We have a partnership with the National Runaway Safeline, which hopefully you all are familiar with. And kind of see what they think. I'm not as familiar with what conversations are going on in the space, and obviously there would be lots to figure out in terms of how do you assure social distancing and safety, and these are minors, and so that's a really interesting thought that I don't feel prepared to totally talk to right now, but happy to follow up with you or any of the people viewing who are interested, and particularly connect you to National Runaway Safeline and other groups that are really in that space and are probably thinking really critically about that right now and what the solutions could be.
Well, and Patty, too, I think that brings up a really good point that, a lot of nonprofits right now are struggling financially because, we've canceled fundraisers and we're having to come up with new resources. And, You know, I think us as a community of child advocates needs to really think about that. So whereas there might be, you know, nonprofits that would support Runaways, maybe they don't have the capacity to do that right now. And how can we support those agencies to be able to continue the work that they're doing? I just happened to think about that when you said that about the shelters, but you know, that's something maybe all of us can try to figure out, you know, how can we do something virtually to support these organizations.
Mm-hmm.
Tiffany, I want to ask a question around someday when we all are let out of our homes. You know, we know that there are going to be an influx and a wave of reports, and you know, when kids see their teachers in their classrooms and guidance counselors. Are you thinking about that as a child advocacy center? And if so, what are some of the things that you and your team are already putting in place, you know, to prepare for that?
Well, I mean, I think definitely we are expecting an uptick. You know, we've seen absolutely a decrease in reports. I just had a meeting with our state Child Protective Services that said, you know, compared to the first 2 weeks of March and then the second 2 weeks of March, it was like a quarter of what they are typically receiving. So I think what that means is we are going to have an uptick. So I think several things, thinking proactively about who will be the first people to interact with youth once we are out of quarantine, out of lockdown. So whether those are camp counselors, childcare centers, faith communities, seeing those kids, so providing extra support and education for those individuals. The signs of sexual abuse or any type of abuse might be slightly different just because a lot of kids are just experiencing anxiety in general and dealing with the stress of having to be quarantined over time. So I think there will be this transition period where all children are exhibiting behaviors where it seems like it could be from abuse and neglect, what we would typically see as abuse and neglect. So I think it's important to really talk with kids about those feelings, have conversations with them about that, talk about transitions back into the world whenever that might be. At the same time, our advocacy center, we have started, you know, we're continuing to provide forensic interview services and family advocacy services for families, and looking at, you know, maybe we have to increase our staff level to be able to respond to the uptick in reports. Also, I mean, one of the silver linings is that it's forced us really quickly to provide telemental health services for children where, you know, we can provide those services. So I think it allows us to continue that even beyond, you know, the COVID-19, the pandemic. And so I think that's an added resource that we can continue to provide both for caregivers and for youth, because I think it's really going to have to be a lot of family therapy when it comes to dealing with that. So so there are, you know, a lot of different things that we're doing and working just across the board to try to increase, I think, as much as possible, if we can use media to help them understand that, you know, reports are going down, but we know that cases are probably going up even in the midst of reports going down. Domestic violence is also on the rise because we know, you know, tensions are high. So I think helping to use the media in educating the mass public around tips, I think that's just all going to be helpful as we go back.
I've been meaning to mention this a couple times, and this will be included in the resources, but we obviously know that phone calls are difficult, particularly if you're quarantined with your abuser. So there is the crisis text line. You can text LIGHT to 741-741. And so that way your text messages are obviously silent. Darkness to Light has been in touch with the teams at Crisis Text Line to give them all of our resources on preventing abuse during COVID-19. So they are equipped and they will help you put together a plan to try and help, you know, mitigate some of this stuff. So Recognizing the time, this has been an utterly fascinating conversation. I do have a few questions that have popped up. So I am going to move to some attendee questions. So the first one, Patty, you referenced a lot of virtual check-ins. Could you describe what some of those virtual check-ins look like? You were talking about the children under 5 when you said that there are virtual check-ins.
Well, people like grandparents that do virtual calls or Zoom calls, neighbors, friends, other folks that you're in a play group with. Plus, the Division of Family Services is following up on concerning. They get calls from people that are concerned. It may not be what you would consider reasonable suspicion. It would not necessarily rise to the level of abuse or neglect. But the fact of the matter is that the embers are starting to heat up and the fire is ready to erupt. And so, you know, kids who you used to see all the time that you don't see, children that are overdressed for the weather, which in some places is obvious and in some places not so much. I remember a case I did one time where it was a 7-week-old baby with two black eyes, and somebody in a store saw that baby and called in a hotline, and here the baby had multiple skull fractures. So it was just somebody who saw something that didn't look right to them. And now you may be seeing it virtually, or you may be seeing it from afar, you may be seeing it in a grocery store. That's the time to make the call. Reasonable suspicion.
Lyndon Haviland, one of Darkness Slate's other board members, was on a Department of Health call in New Mexico, and they have actually seen an increase in reports from delivery drivers. So people, you know, Uber Eats and DoorDash and all of that, they've had an increase of reports. So there are people out there who, you know, don't wear capes, who are making these reports, who we don't typically focus on. And I think it's important, again, to remember that what you said earlier, Patty, it's everyone's responsibility. And in order for us to be able to protect kids, we have to think outside the box right now and reach the people who are in touch with those kids. So going on to the next attendee question, Janice, I'd love to hear from you. This is a conversation. So these types of conversations can be really hard to have with kids. Adults might not be ready, feel prepared to talk about what abuse or, you know, prevention of an online predator. And add to that parents are actually feeling super stressed because their teachers and their employees and they're, you know, all in the home. How do you recommend having difficult conversations about difficult things with some sort of clear mind when your mental health is sort of not at its normal, what did you call it, say, calibration?
Yeah, I'm sure that there are others that could address this question, especially about talking to kids about those kinds of topics. But in general, the advice during this time would be the same as the advice in any time, which is to get as balanced as possible before a conversation happens. Recognize that it's probably, you don't have to be perfect. Kids don't need perfect, they need authentic. Yeah. So, I mean, I have I work with a lot of families that that have to talk with their kids about hard stuff related to self-injury and suicidality and so forth. And it's really okay to not do a beautiful job with that conversation. The power comes in saying, this makes me uncomfortable. This is hard for me to talk about, but it's really important for me to talk about with you. And so even stumbling through a conversation with an acknowledgement that I'm human and this is awkward and these are the things I want to talk about with you is, if you're being authentic, really is doing two things, because it's addressing potentially important things as well as communicating. It's actually demonstrating, you're modeling how to have hard conversations and be a messy human. Because that's, you know,
I get through all my public speaking. I'm nervous, so I tell the audience I'm nervous, and then I'm not nervous anymore. So
exactly. Yeah.
That's awesome. Thank you. Did anybody else have any? Oh, go ahead.
No, I was just going to say, maybe preparing a few things in advance can help too. If you think through maybe like what are the core messages, so that you're not trying to find it while you're just talking, that can help make it a little smoother.
You must have been a Girl Scout. Always be prepared. All right, let's see. So what are some examples that adults can use to check in with kids without leading them? So are there, you know, if you're trying to figure out if a kid is potentially being harmed or taught having conversations they're not supposed to be having. What are some of the tactics you use to get kids to become more comfortable leading to that conversation?
So, like, just any difficult conversation with kids? Is that what you're referencing, Caitlin?
I would, that's what the question sort of alludes to, yeah.
So, I always think back to, do we know what our kids know? Do we really know what they know? So start with a question. What do you know about, or what are you seeing your friends do, or what have you seen happen online? Rather than just going into the hard conversation, start the conversation with something a little easier. And it's funny because when we do facilitator trainings, we hear stories from school counselors across the country, and parents always think that their kids don't know what's happening online or with sex or whatever. And kids know way more than we know. They know way more than we know that's happening online. But the other thing too is to remember, you don't have to necessarily sit down and have a face-to-face, eye-to-eye conversation with a child to communicate. So you can do things like have a journal, and you write a question or a prompt in the journal, and then let your child respond to that and give it back to you when they're ready. Eventually, yes, you probably do want to sit down and have that conversation face-to-face to clarify and educate and empower them. But there are ways to get that started that aren't so in your face and scary and anxiety producing for the parent or the child.
Mm-hmm. I think so too. I'm sorry, Tiffany, did you want to?
Go ahead, Susan.
I was going to say, I hear in the question, like, I don't want to be leading. And I think that's really important. And I used to be a forensic interviewer, so I'm very attuned to that. But I also, I don't want adults to shy away from direct questions. Because if you are worried about something you saw that they were doing online, or their behavior towards somebody, it's worse to not ask and let something continue that's harmful than to ask in a not ideal way. So if you're starting the conversation gently and you're kind of dancing around it and you're not getting at what you're concerned about, just ask. Like I noticed when you went with the babysitter, when you got online with your guitar teacher, that you looked really upset, or I know whatever it is, just ask them. Because I always, used to tell people when I trained on stewards, as an interviewer, if you ask a not great question, if you ask kind of a leading question, that can be fixed. What cannot be fixed is a kid who wants to tell you something and they get shut down because you're so scared, you're so nervous, you're dancing around it, you're upset. So your calm demeanor, and if you have to ask, just ask. And just say, I don't know, I saw this and I'm not sure what happened. Please tell me what happened, or tell me everything about it. You can ask in an open-ended way. Don't get so caught up on not being leading that you're not asking and checking in on kids. Like, don't. So
Susan, that's such a great point. And I think,
I'm sorry.
Go ahead, Patty.
Comment about demeanor is really important too, mm-hmm. because kids can be turned off so easily by your demeanor. Right. If I ever found out that somebody was doing that to you, I will kill them. Like, that kind of message to a kid is basically saying, don't tell me if someone's doing something to you, because I'm going to have to go out and commit a crime. And that one, you want to start, and it doesn't start, with some deep thoughts. It's just like, hey, anytime. I used to say to my daughter, there is nothing you could ever say to me that would not make me love you. Nothing. So if it's going to make somebody angry or hurt somebody, that's okay. If it's going to hurt me, that's okay. You need to know that whatever you say, I will always love you. I will always support you. And she goes, what is this about? What is this about? But mm-hmm. The fact of the matter is, I think she would tell you now that she was never afraid. And her friends still call me. Yeah, I've got this problem. I really don't know who to talk to about it. I think that demeanor is so important, because the looks you can make with your face or your reaction can be so detrimental to children in terms of their being forthcoming.
Yeah, and Patty, I would just add, I think that starts, before we have the more accusatory conversations, or maybe not accusatory, but we're asking about something that might have happened. it helps if we've already had more proactive conversations and some of those positive conversations with kids about how much we care about them, how much we love them. And all of those leading up to when we start to have those difficult conversations, we've kind of paved the path for it. And it happens a lot easier because kids are ready for those. They're ready to have that conversation. And those nurturing connections that we have with children are so, so incredibly important for their resilience in general, just to be able to overcome this. I've talked about how hard this is for all of us, not just for my kids. I'm very open and honest that this is a difficult time for so many people. And, you know, be honest and open about your feelings about it, and I'm going to do that with you. I had a really bad day the other day, and I sat down with my kids and we processed that together. And I said, thank you for being you, because you've helped me get through this. I mean, those kinds of conversations are really important.
Can I just quickly jump in? And
of course, yes.
I was just really quickly say, because I want to link to something that was just said, and that is that I worked with a lot of parents who really messed up their first conversation about hard topics because they were afraid or because they didn't know, or all the different things that come up. And one of the most powerful things that can happen is to go back to a kid and to say, I really feel like I messed that up. I did not, this isn't what I wanted to communicate. What I wanted to communicate is I love you, I'm here, I'm ready, and I can have this conversation now. So can we try again? Because I've noticed that can reopen doors that seem like they're shut sometimes forever. It's when that's the only communication that happens, and there isn't any humility and there isn't any trying to reopen the door, that things can get really stuck.
This has been amazing, and I am very sad to report that we only have 4 minutes left. But I want to take the last question, and I'm so sorry to the attendees. My team has done a great job compiling all of your questions for me, and we won't get to all of them. But my last question to the panelists today is, how can we help reach more at-risk parents and children? Households that aren't online, households that have children with intellectual and physical disabilities, you know, what LGBTQ youth, like what are some of the more at-risk population tactics that we can all take to find and help those adults and kids?
I think I've seen a lot of educators doing some drive-bys in communities and kind of like neighborhood gatherings, but they're not like all getting together to just say hello and say, I miss you and I'm thinking about you and I'm here for you with whatever you need. I think that's been really helpful just for some. Again, if they're getting food services and things like that, reaching out to those individuals so that they can just check in. One of the other things that our schools are doing is using some IT reports like Go Guardian, which monitors things that kids are looking up online. And so we've had some kids, you know, one kid was looking up suicide 20 times, and this child hadn't checked in at any other point, but a teacher was able to identify that child and make a report because they were concerned about that child for suicide attempts. So I think that we just have to be creative in those ways to kind of reach out to them.
I think go where those folks in need are, Caitlin. So, you know, we have really good relationships with Special Olympics, and we have the Beau Biden Foundation has a partnership with them. We have a partnership with the Down Syndrome Association. So I go on their website every day and I talk about sharing resources. Tiffany just mentioned volunteer where you can, like at food banks, where, you know, you can be a safe distance, and you can also let them know what your expertise is, how you can help them. So look, you run a food bank. This is not all stuff that you may know about, but hey, if you see something that concerns you, call us. We're okay. Yeah, we're all working from home, but please send an email, give me a call. I'm more than willing to sit down with you and go over. We're going to do trainings for some of those folks too through our virtual platforms. We'll go on Zoom. We'll train y'all what to look for. We understand it's not something you ever really worried about, and now you are terrified about it.
Yeah.
So reach out to those of us who have the experience and expertise, and we can help you in this time of need.
Caitlin, I think that was a critical question, because like I know in Florida, we have some areas that are so rural, they don't even have internet providers. There's no internet, so we can't reach them virtually. They can't be taught virtually. Teachers are delivering packets of homework. And I think at this point for all of us, it's how do we reach the masses and hope that that information gets to where it needs to get to. So, you know, giving, and I know you guys are going to provide the attendees with a lot of resources after this, but getting those resources out into your community and thinking creatively, how do you get them? You know, if homework packets are being delivered to kids at home, slip a resource card in there that has hotline numbers, you know, and maybe it will get to the child. We don't know that it will, but you know, all we can do is do the best we can do and hope for the best, and not give up, and just keep trying to find ways to get to those kids that are so at risk and not getting the services that they need right now.
Wow. Well, it is exactly 4 o'clock. And so I just want to say it astounds me every day that I get to be each of your colleagues. So thank you so much for the work that you do, the organizations that you do them at. Thank you to all of our attendees for joining us. I saw lots of very high numbers on Zoom, and I'm sure some other people were streaming on YouTube. And I also want to give one final shout out to my Darkness to Light team, who worked countless hours behind the scenes to make this possible and to put together all the questions. And I know this was not an easy lift for you all. So we will be sending out follow-up information. If you did not sign up for this and you are streaming on YouTube, please make sure you send your information to us so that we can give you all of the links, and we will add some of the things we talked about, Mood Meter and Good Guardian and lots of different resources throughout. So we'll make sure we add those resources to the links. But again, thank you all so much. I could not be more proud. Keep up the good work. Go for your bike rides, do your meditation. And hopefully we will see you on the other side very soon, because I miss you all.
Thank you, Caitlin. And again, as a member of your board, I'm so proud that your staff, just amazing, and the leadership that you provide them really is inspirational. So thank you from all of us to you and to your staff. I hope you all stay well and stay safe. And I would say enjoy yourselves.
From my couch to my desk, that's basically my life. Thank you all. Take care. Have a wonderful week.
Bye-bye.
Thanks. Bye.
Bye.
Bye.